Hello, everybody, and welcome to another episode of Let's Pick This Up Next Week. I'm Dee, and we're joined by our favorite co-host, Dr. DJ.
Hey everybody,
How's it going, DJ?
it's going all right, Dee. Feeling a little
Just
bit
all
of
right, huh?
burnout. Feeling a little bit of burnout this week. That's why when we were talking about topics, that was the first thing that was on my mind.
Just talking about burnout. Have you ever been burnt out before?
I've been burnout before. I feel like that it's rough. It's rough when we have a job like we have.
Mm-hmm.
Yeah.
It is. I think of as a therapist, I distinctly remember when I started 10 years ago seeing clients, I remember thinking, I can't do this forever.
hmm
It costs some of what you are to be a good therapist.
Right. Right. And I think when we think of burnout, a lot of people think that it means that you're just tired, but really it does. It takes it's physical, mental, emotional, just energy that happens, in our job and for a lot of people in a lot of other jobs. But we know how it is with our job, and I think especially being an introvert, which a lot of people think that therapists, are obviously extroverts, to be able to talk to so
No.
many people all day long. But I'm introvert, you're an introvert, we're both INFJs, right?
Mm-hmm.
Yeah.
INFP.
And
J. Ooh.
oh, you are you a
I
P?
mix it up every time. And then my
Mm,
boyfriend has to correct me because he remembers what I am. I think it's
yeah.
INFJ. I think
Yeah,
so.
I'm pretty sure
Sorry,
you're an
honey.
INFJ too.
I think so.
Yeah, INFJ. But it definitely takes a lot of that peopling energy, out of you when you're doing therapy with people all day
Mm-hmm.
long. But then on top of that, I'm a director, so I have admin stuff, so I don't even get breaks in my day. I'm in the middle, this is my break today, and I'm in the middle of I don't know, 11-hour day. My Thursdays are, and fitting in meetings. Today's a client day, but I had a meeting this morning, so almost all those hours are filled with some kind of peopling and the stress of balancing an admin job and the stress of life doesn't stop too, so I have to do life stuff.
Mm-hmm.
I'm taking a PTO day tomorrow, so
Me
and
too.
I don't do that lately. So, I knew that I needed to because I'm feeling every day I don't know if I have it in me. And I have to rally myself up to see a patient because I don't need them to know, or a client. I don't need them to know that. I don't want them to know that I'm struggling
Yeah.
to show up. So,
And you make a good point that a lot of careers, a lot of people experience burnout. It's not just therapists, right? But we're here to talk
hmm
about our experience as therapists. That's the whole point of this
hmm
show. And I feel the same. I think it's wearing that many hats, and when you're a therapist, you hold space for people, and that is heavy. So it's
hmm
hard to hold that space for people. And then when you are working in a position like we have as directors, then you have to hold space for you have to task switch into okay, well, now I'm an advocate for my department, or now I've got to be a bit of a financial guru, or now I've got to think
hmm
about PR, or now I've got to think about HR, and now I have to think about, you know what I mean?
hmm
It's all of those things. And then it's life stuff. Life stuff on its own is difficult, let
Right.
alone peopling in our jobs, because we have
Right.
to be present for those hours. I know.
We do. We have to. We can't not show up for our patient because we have all our energy kind of zapped. And that's why it's important to take time off. And it's do I want to say this? I'm always if my job sees my podcast, but it's interesting because it just kind of went into my point of why I feel this way. So at the town hall today, they gave shout outs to
Mm.
staff who go above and beyond, and three of those shout outs were about either a staff member that worked while they were on PTO that stayed late or was available at any time. And
Ugh.
that was three of the eight, maybe eight shout outs for that kind of stuff. So you just see the culture and the value, and I'm like, no thank you.
Mm-hmm.
That's not what I value anymore, is not being able to know that my time is my time.
Mm-hmm. I
I'm not going to
definitely
work on my PTO.
exactly. I have
Mhm.
so I tell my team I have 2 different types of time off because I am off tomorrow, but I'm working on my bathroom and I just want, like, a full day to do it.
Mhm.
So it's not like I'm, like, disconnected from the world, but I tend to tell my staff I take 2 types of days off. One, where if there's something like, urgent, don't reach out to my supervisor, reach out to me, but,
Mhm.
question what is urgent. Is it an immediate
Right.
issue or is something can be solved the next business day? And I have days where I'm like, I don't know, make it's anyone else's problem. I won't answer my phone. You can call me
Right.
repeatedly and I'm not answering it. Like, and I won't feel bad about it because if it's an
Mhm.
emergency, call 911.
Right, right. And with my job, we're outpatient therapy. I don't have us have an on-call therapist because of the fact that we're remote and we're outpatient. And then I think that we're not the place that should be doing that, there are resources out there. So there's really nothing in my job that
Mhm.
like needs to be dealt with like that
Yeah,
day.
that is nice. I mean, I've got some residential facilities as a large chunk
Mhm.
of things, but it's still
Yeah,
like there is no world where I'm the only person that can answer a question. No,
exactly.
no
Right.
shot. Like if I'm taking one of those days off, I have coverage. I'm like, this is who you staff
Mhm.
clinical cases with. Here's who these questions come with. You know, there's other
Right.
experts that they can go to.
Mhm.
But it's so
Mhm.
admired in our field to just,
Mhm.
be a workhorse. And
Right.
we mentioned right before we started recording of like almost every therapist I know has a side hustle. And
Mhm.
like I have multiple side hustles and it's gross. Like I like doing them all because it's like it
Mhm.
flexes a part of my creative brain. I enjoy all of the
Mhm.
tasks individually. But in a world where it's like, oh my gosh, my 9 to 5, quote, 9 to 5
Mhm.
zaps my
Mhm.
energy, then I'm also, doing all of these other things. And I don't know, I'm growing tired of hustle culture.
Right. Yeah. And I think that like when we were talking about what are some solutions for burnout, and I said to you, like, you've been at your job for a really long time.
Hmm.
And a lot of times in this field, I think like the statistics are that people change jobs around like every 2 to 3 years. And
Hmm.
one of the reasons why is to prevent burnout from doing like the same thing all the time. And, and I think that's part of the reason why we have like the side hustles too, is to give us like a different type of work to do so that we're
Hmm.
not just doing the same thing all the time, and it's also like outside of our like just self-care. So, and I just signed an offer letter to be associate faculty, and that's something you've done for a few years as well. And I'm
Hmm.
just moving into it in the doctoral level, doctoral. I don't know,
Doctoral. Just kidding.
doctoral.
That word sounds awful.
Doctoral. I don't know,
Doctorial. I think it's doctorial.
doctorial.
I don't know.
Mm.
Leave it in the comment
Anyway,
section, guys. Who
yeah.
knows?
Anyways, so I'll be like an associate professor, like, teaching maybe like 10 hours a week or something,
Most of
which
our
is,
friends
which
are
is,
also teachers, even if they don't
yeah.
have a doctorate in
Huh?
counselor
You
education.
don't,
We all teach
hmm
something.
yeah, yeah. So, but yeah, I mean, and then you have like a side hustle of like doing some consulting and training
Hmm.
and not to mention all of the trainings that we do for free at conferences.
This is
Mm-hmm.
true.
Mm-hmm. Yeah.
Yeah, and then this crazy friend of mine about a year ago said, "Wouldn't it be great if our next side hustle was a podcast?" And I said, "Yeah."
I was just thinking about that when we were talking before we started recording. That when you were talking about Thanksgiving last year, I was like, we've been doing this for a year because
We
I
have.
remember I remember talking about Thanksgiving last year. But we also joked about how we have to change the name of the title from "Let's pick this up next week" to like "Let's pick this up eventually" because we don't
Yes.
record every week.
Not anymore.
Busy
Yeah,
schedules, yeah.
we haven't been recording for a year. It took us
Hmm.
3 months to workshop that name.
Did
Like, let's
it?
just put that out there.
Man,
It
that's
took
good. Yeah.
forever.
Did
Like,
it? Yeah.
I know you still don't listen to the episodes, but we don't have 52 episodes. Okay.
Well, I mean, we don't record every week. How many? When was our first episode?
I don't know. I'll look it up while you talk.
Hmm.
Talk about something and I'll look
It's
it up.
been it's been a while. We were
Wait.
just talking about burnout, and 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 how anybody can relate to that. I think anyone that's listening to our podcast has probably experienced burnout at least once in their life. But it is really important to be able to not have shame come along with that, given that like we said, a lot of people get recognition for going above and beyond, which means that they're doing more than they should, and
Mhm.
not having work life balance and not taking care of themselves.
Can I get on a pet peeve here, speaking of, like, work stuff? By the way, February
Yeah.
21st of 2024, our first episode
Was
came
it?
out.
Okay. Okay.
Yeah.
That's
So,
been a good
8
while.
months. Yeah.
Yeah.
Is that
Mhm.
how math works? Yeah, 8 months.
That is it. Yeah, thanks for
Um,
that math. Mhm.
but here's the thing too, because you said, like, going above and beyond, and, like, I agree. I think we need to just normalize that, like, being engaged in work
Mhm.
is great. Being busy at work is great. Being, like, hyper engaged and stressed and overwhelmed at work, like, that's
Mhm.
too much.
Mhm.
Um, and can I also gripe that, like, the idea that, like, saying work is like a family perpetuates that.
All right.
And in my TED Talk, I will tell you
Mhm.
my brief soapbox on this is, like, I don't like the idea of work is like a family, because it's not.
Mhm.
Because families, you don't get to, like, fire people from your family, right?
Right.
I think of work as, like, it's a team. If you're not a good fit for this team, that doesn't mean you're bad or wrong. That just means you're not a fit
Mhm.
for this team. But families stay together. They're toxic. They can be enmeshed. Uh,
Mhm.
Families aren't always the healthiest systems. And I'm like, I don't want people to feel like, I don't know, like, I'm no one's mom. I won't be your
Mhm.
work mom either.
Right. Yeah.
But I think it perpetuates it, because it becomes like we tolerate things in workplaces that are unhealthy when we
Right.
think of it's like a family. It's
Right.
like, this is a team, you know.
Yeah, that's a good point. And I talk about that, when I talk to people in therapy about the autonomy, being your authentic self, and the fact of like where we kind of learn those ideas. And I look back to like school, how kids are like forced to go to a school that's like near their house, and they have
Mhm.
to like fit in with other kids who live near that building. And that's the idea of where these ideas fit, that you have to like be something and fit in with people versus like being authentically yourself. And then they go into adulthood and worry about that. And I'm like, literally, that is the only time, if kids are made to go to a school and not some other, or they don't go to like some schools are better, like they have like schools for kids who act, or schools for kids who like,
Mhm.
there are some of those, but a lot of kids just go to like the public school near their
Mhm.
house. And so like I'll be talking about that in therapy, and the next thing someone will ask me is like, what about work? And like, you
Mm.
have to fit in with the people at work. I said, or you could go to and find a job where you do fit in, where that's more
Mhm.
aligned with your authentic self, because people don't have the idea right away that like, if a job's not great for them, they can just leave.
Yeah,
In most cases, some people might
absolutely.
be like, it might be hard to find another job, or they might have to stay because they have like some type of retirement, and like they're not going to find it, whatever their
Mhm.
values are. But still, like, you do you don't have to stay at work if it feels like a dysfunctional family.
For sure. Yeah, you can
Mhm.
probably find a less dysfunctional family, but it's like, it's hard, it's scary to leave jobs and
Mhm.
that kind of stuff. And I think that's why when we then start to feel personal ownership over things like that, like, a lot of people are like, well, I don't want to leave my job because XYZ is going to be, let down or whatever. And it's like,
Mm.
I mean
Mhm.
this with all the compassion in the world. When you resign, they'll put up a
Mhm.
a position vacancy or not. They'll just redistribute your responsibilities.
Right. Right.
And then that's that. Like,
Right.
unfortunately, you will be replaced at work. You as a
Exactly. Yeah.
person are not replaceable, and you bring all your
Right.
values and skills and everything
Mhm.
amazing about you from role to role,
Mhm.
but you can't take personal accountability when it's not about you.
Right. Yeah. Exactly.
But you mentioned one of the ways to, like, help burnout, obviously, is some folks, change up what they're doing, they change their role. I know for me, one thing that's helped is I use the stoplight system at work. Um,
Mm.
so I taught this to my team, and I ask them to do the same that I practice for myself, because I used to say, like, I'm not burnt, I'm crispy. Like, I'm not there. I'm not like, done past in place of emotional exhaustion, but like I'm getting there. So we use like the green, yellow, red system. So if I'm green, that
Mm.
means like I'm here, I'm good, I'm engaged, I'm like, and hell, you can have a green morning and a yellow afternoon. And
Mhm.
yellow meaning like, hey, like I'm okay. It's not the day to give me anything that's like overly difficult. Like a yellow day is not the day to put a staff on an action plan. A yellow
Mhm.
day is not a day to like give constructive criticism. It's not a day to like be the bearer of bad news. It's the day to be compassionate. We should always be compassionate, but you know what I mean?
Mhm.
And then red is like, I shouldn't be here today. Like, please
Mhm.
help me leave.
Right.
Um, and so a lot of times I've stopped telling my team like I'm crispy, but I'll say like, it's a yellow day for me, guys. Like, that's where I'm at. And that's me
Mhm.
practicing my humanness. And I'm
Right.
happy that they do
Right.
it too.
Yeah. No, it's a good system. And that really does. And I think like that's the thing. Like, I work in a company that is primarily uh psychiatrists and
Mm-hmm.
nurse practitioners. So there's a whole different culture when they're going to like medical school, and it really is like go 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 until you drop. And
Mm-hmm.
thankfully, like we don't come from that culture, because when we were in grad school, one of the things that we focus on is boundaries and self-care. And it's funny talking to some of the psychiatrists who'll be like, every time I talk to a therapist, they talk about boundaries or they talk about self-care, and I'm like, that's because that's what we talk about when we're in school. It's
Mm-hmm.
not, it's very, very different from medical school, especially for psychiatrists, because they're all through medical school. So, they really do thrive on that idea, which is unfortunate, because then those are the people that are providing a lot of care in a lot of different areas.
This is
Hmm.
true. And
Right.
also a field with high turnover and not enough people
Hmm.
who are seeking it out. You mentioned self care, and I think
Hmm.
that's a term that we hear a lot, but perhaps maybe not defined in a therapeutic way. So, when you
Yeah.
hear self care as a therapist, what does that mean to you?
I think that, and that's good, because a lot of people are like, not only do they not know the definition, but they're like, I've never done anything like that. Like, so it really is. I think when I think of self care, it's doing anything that I like to do for me, and it's going to
Mhm.
depend too on like the energy maybe that I have at that time, because it might be I like to binge shows, so I might lay on the couch and just like pick my favorite show and watch it for some hours. Or it might be I'm gonna go one weekend I rented a jet ski for an hour and took that and rode it. So it's gonna depend on the energy that you have, but I think it's like doing something that you like to do for you, just for you,
Mhm.
that feels good and can recharge you.
I love that. That's a great
Mhm.
definition. I think two people think of like self care as something very big. Like when I tell
Mhm.
people like practice some self care, and I would say that with my supervisees too, is like, okay, what are you going to do for self care between now and our next supervision?
Mhm.
And uh, at the beginning of it, people are like, I'll take a bubble bath or I'll paint my
Mhm.
nails. And it's like those are can absolutely be self-care things, right?
Mhm. Yeah.
My best piece of self-care for me is like find my favorite song at the moment in my
Mhm.
car and just like crank it that's like way
Mhm.
too loud and just like sing it to the top of my lungs. Like that's
Yeah.
self-care to me
Mhm.
because it's
Yeah.
just those couple moments where like this isn't performative, it's not for anyone else, it's just
Mhm.
for me in this moment.
Right. Yeah. Something for you. That remind me of some of the coping strategies I tell people, which is go in your
Yeah,
car. Go in your car and scream. Just like scream as loud as you can. Go in your car somewhere where there's not somebody right next to you.
for sure.
And I saw that in a movie recently. It was a weird movie though. It was
Mhm.
it was See No Evil, Hear No Evil.
I
One
think
of one
See No
of the
Evil's a movie. I don't know.
I feel like it's not. I feel like it's Speak No Evil. Maybe anyway, it's a movie that just came out like in the last 3 months. They did that, and the guy who had him do it though was like a killer. So it doesn't. You don't have to be a killer to
Mm.
want to scream for like. It is a good. It is a good. It really does get that. So like you listening to music and singing loud, it does like the
Mhm.
same kind of thing as like But that's a good coping strategy. I don't know if it's self-care. I imagine it's self-care too.
Yeah, because like to me, it's like that break. Like I'm not looking at my phone.
Right.
I'm not needing to people for those couple
Right.
minutes.
Yeah. Yeah.
Yeah.
And it makes sense that with a profession where we're peopling so much that our self-care, both the things that I mentioned are by myself. When I'm thinking of self-care, I'm doing something that I'm not doing with anybody else, and
Mhm.
I don't have to talk. So,
Not talking is definitely a big part of it. Is like I don't want to
mhm.
communicate. I just want
Mhm.
to just be.
Yeah.
Yeah.
It's interesting thinking of like being an introvert again. Like I went roller skating, and I don't know if I would say that's kind of as I went with my girlfriend, and when she was like, it's funny that like you don't feel like peopling, but you go roller skating. And you choose to go roller skating. I'm like, I don't need to people to roller skate. There's people there, but I don't need to engage with anybody at all.
I know exactly what you're talking about. I don't know if I talked about it on the podcast, my Happy Thursday bike ride. Have
Hmm.
I talked about this here?
I don't remember. No, I don't think so.
So it's a bike riding group that meets
Mm,
in Sandusky,
okay.
and it's the Happy Thursday. We meet on Thursday nights. We go and
Hmm.
bike around. It's a different path every time. And so I bought myself an electric bike this year. That was like,
Nice.
yeah, and I'm jazzed and I love her. Her name is Luna, my bike that is.
Hmm. Hmm.
And it's so nice to go to these Happy Thursday bike rides because it's like you see a lot of joy. Like the rule is when you see people, you have to ring your bell and yell Happy Thursday. Like that's the
Mm,
expectation. And there's something about it that's so like, would I ever by myself go biking and yell Happy Thursday while ringing my bike bell at people? No,
yeah.
absolutely not.
Hmm.
But I'm around these people. Like this is like 150 to 200 people every week.
Really?
It's so fun. It's done for the year now, unfortunately, but like it's
Hmm.
such a fun way to just like, I don't need to people. There's people there, but
Right.
like I can just have my experience, or like it's typically me and my partner will go. My
Hmm.
dad's come a couple times, like, but it's just a way of like parallel being around people
Right. Yeah.
without having to actually engage with people, because you're
Right.
biking
Yeah.
by. Happy Thursday
Right.
as you're
Yeah.
biking
Exactly.
away.
Hmm.
So that's
Yeah.
my
It
self care.
that's pretty cool. It's
You
done
should
for the
start
year because you're in Ohio and your guys is it cold there
it's
already?
today, but it's going to be 80 degrees tomorrow, but it was 40 last night. It's wild. But
Insanity. Yeah.
yes. Um, yeah, it's lovingly referred to as a cult. We're definitely a cult. So
The biking, the Happy
our
Thursday
Happy
call.
Thursday bike ride. Yeah, it's a Happy
Yeah.
Thursday cult.
Hmm.
Yeah.
It's
Anywho.
a good way to prepare for Friday.
Exactly.
Hmm.
What coping strategies do you use as part of your like integrated self-care plan?
Yeah, and I think that that's part of it, right? So we've talked about like self-care after, but like really you have to try to prevent burnout.
Mm-hmm.
And that's the thing that we were talking about earlier. So I know for me that I used to never turn off work. I used to never turn down work. I used to like anytime somebody needed me, I was available. And I learned to not do that anymore.
Mm-hmm.
That when I leave work, I leave work. Um, I don't look at messages. I don't look at my email, except for I
Ooh.
do have to a lot of times chart into the evening because that's the thing about our job is that we have to document our sessions, and there's not always time in the 7 minutes in between a
Mm-hmm.
session. Or I
Mm-hmm.
sometimes try to concurrent document, and that's not always easy to do either.
Yeah,
So,
this is true.
with the exception that I sometimes do have to do charting outside of like my workday is not done. I'll tell people like the talky part of my workday is done, but I can turn on the TV and sit at my desk and chart, and that's not as bad.
Mm-hmm.
So, but I do. I have boundaries around like when I'm going to answer messages and making sure that I like, start my day with intention, so getting up because I work from home and I can
Mm-hmm.
easily like crawl from bed and come straight to my desk and start working, but I don't. I get up, I take a shower, I eat breakfast. I have the same morning routine that I would have if I worked away from home.
Mm.
I try not to work on my lunch, I'll be like, this is something I'm going to do tonight. I'm not going to, or not, or I'll do it on my admin day. I'm not going to do it during my lunchtime. So, I try to have those type of boundaries. And again, like when I leave the talky part of work, I don't think about it. I
Mm,
really, I really do have a pretty good boundary around not taking on my patient stuff, and I don't think about cases. I don't do that outside of while I'm with the person.
mhm,
Those are some of the things that I do to try to prevent burnout. But I think most of my burnout comes from, again, like policy changes and thinking about that stuff and navigating,
mhm,
some of the stress that comes with that,
for sure.
and take my PTO
I
time.
yes,
Mhm.
taking time off and actually being off. Uh,
Mhm.
and I say this as someone who completely I'm either so enmeshed in work or I'm like, good. And like right now, I call it high tide and low tide. It's the best way for me to
Mhm.
conceptualize. Like right now, I'm in low tide, like I'm not drowning. And so I've been
Mhm.
able to separate myself from work more. But normally it would be a lot of like drag myself away from the office, log
Mhm.
back on, usually like in front of the TV. Like I've had to really practice these last, I don't know, probably 3 or 4 weeks, like how to separate. And I'll tell you what, the greatest thing
Mhm.
is an IT issue with my phone. So
Oh.
I have an agency device, I have an agency phone, and a personal phone. I made the choice like they got to be separate phones.
Mhm.
Which the like cheap part of me is like, but work would just pay for my phone if I just like, but I can't do that because then I'm like seeing it all the time. Here's the thing: I upgraded my phone to the newest iOS, like I'm on iOS 18 on my work phone,
Mhm.
and it turns out our VPN does not work with iOS 18. So my
Really?
work phone has not worked in like 3 weeks. And I would always tell myself like, oh yeah, like I check my phone for my email or I check my calendar because it like lessens my anxiety to just like go ding ding ding, okay, I've solved those issues and moved on. And I'll tell you
Mhm.
what, these last couple weeks of my phone not working, after I got over the initial stress of like, oh my God, like what am I walking into? Once I got over that, it's like
Mhm.
amazing. Like I'm just like, what am I walking into? I don't know. I'll find out when I get there. Me knowing
Exactly.
30 minutes
Yeah.
beforehand doesn't really help anything.
Right. That's a
So,
good point. Mhm.
yeah, so I don't plan on doing anything about it until they figure out
Good.
how to fix the VPN with iOS
I
18.
mean, the thing is like, well, I mean, expectations are a little bit different because, people in workplaces do know that we're available because we have cell phones and that kind of stuff. But like, for most of our modern age, people weren't available with cell phones and you didn't deal with work until you came into the office. But, and I think like it's really learning. And I know for me, a lot of my abilities to be able to practice self care and abilities to be able to turn off from work came from the fact that, like, I know that whatever I walk into at work, I'm equipped to deal with it when it comes up.
Mm,
I don't have to like prepare or like, I've done this job, I know the job, I trust in my abilities to do the job. So, I know when something comes up that there's not
mhm.
very much that comes up that I've never experienced.
Yeah,
Maybe that helps with age too. I mean, I am like, a
a
dinosaur,
bajillion.
a bajillion and a half years old. So, I don't know if that does come with like more life experience because there's less surprises and I
I think
like to
part of
have
it's just
context.
confidence.
Yeah,
Like
yeah.
confidence in your role. Like there's not much that will happen tomorrow that I haven't experienced yet already
Right.
in
Yeah.
some way. So
Hmm.
yeah, I can totally get that.
Yeah. And I like that you said confidence because people will ask me what is the difference between confidence and arrogance. You
Oh,
know. Yeah. And confidence is like knowing that you know how to do your job, but you don't have to like brag about it. You don't have to
mhm.
like try and put on a show because normally arrogance doesn't come with confidence. Arrogance
This
comes
is
from
true.
like the opposite of being confident. So if you really like and being okay with making a mistake because in order to
Mhm.
be confident you have to be okay with, you know, I can make a mistake.
I am constantly somewhere between imposter syndrome
Mm,
and confidence, but the imposter syndrome's gone away quite a bit. It's more of just
yeah.
like that, dang, did I actually? Okay. All right,
Mhm.
good for me. I did.
Yeah. And it is like, what helps with imposter syndrome too, and I use this a lot with my clients is remembering that like most most of what we learn on our jobs, we learn on the jobs, right? Like even if you
Mm,
have a degree or whatever, like you are there and you're going to be learning all the time. And I help people that come to that are like in college. I say like you wouldn't be going to school if you already knew all the things. Like that's not what you're doing there. You're there to
mhm.
learn. And so remembering that in learning, you're going to make mistakes.
Yeah, I like that.
Yeah.
I think too, confidence plays a huge role in burnout because it's like
Mhm.
having the confidence to just set those boundaries, but also the
Mhm.
confidence to like leave it, right? Because I
Mhm.
remember a time where I wasn't confident in, let's say like my public speaking. And so I would spend so much time. I could not turn my brain off from
Mhm.
public speaking. I would mentally be rehearsing all the time. I wouldn't sleep the night before because I'd be thinking about it. And like, that's exhausting. It's cool to
Mhm.
have a little bit of those butterflies before something new.
Right.
Like, that's a cool
Right.
challenge. But when you have the
Mhm.
confidence of, like, yeah, I can just do it, I
Mhm.
can prepare and be confident and know my stuff,
Right.
but not burn myself out by like never shutting that part of my brain off or never closing my laptop on that thing.
Right. Yeah. And it is like, if you lack confidence, then you might be afraid to like take PTO because what if they, especially imposter syndrome, what if they know, what they find out that you're a huge fraud and you shouldn't even be at this job. What if they find it out and while you're on PTO and then they just fire you because, they know that you clearly shouldn't be doing this job. So imposter
Most
syndrome
people fake it till
definitely.
they make it anyway.
Yeah, but imposter syndrome can definitely, lead, even though despite people telling you you're good at your job and stuff, if you have imposter syndrome, you should not believe in it. So
This is true.
it's harder to take time off of work if you're afraid that people are going to find out you're a fraud.
Hmm.
Yeah.
I just started reading this book and I'm not eloquent. I'm like still in chapter 2 or something. It's called Never
Mhm.
Not Working.
Oh yeah.
And so far it's really interesting. I don't want to like give a gold stamp on the book because like I don't know enough yet. But it
Mhm.
so far is talking about, it uses the term workaholic, which I hate because I'm like,
Mhm.
ugh,
Mhm.
why do we, why I
Right.
hate it because like we call people sometimes alcoholics, which I'm also not a fan of. I'm a fan of person first language for me
Mhm. Mhm.
personally, but also it's like a workaholic. Like what's a workahol? Because an alcoholic is on
I know.
alcohol.
You're right.
Workaholic,
It's a work ick.
yeah, grammatically and like knowing the origin of language, it doesn't work. But that aside, it talks about workaholic and workaholism, and it's talking about like some people are driven from external factors like that anxiety, like that status, like whatever that might
Mhm.
be. And other people are driven from like those internal, uh, the want to strive to do more. And so you can be an engaged workaholic, you can be a disengaged workaholic, you can, whatever.
Right.
But it basically boils down to like that idea of putting your all in and never stopping is not a healthy thing
Right.
at all. It's just not
Right.
healthy.
Right. Yeah. Yeah. It's a good title for the book too. I
I
had a
thought so too.
thought.
That's why I bought it. Yeah.
Yeah. I had a thought when that definitely like there are some people who you say are who are externally focused by anxiety. And I work with clients who had high levels of anxiety, and one of their fears was that they wouldn't do anything if it wasn't for the
Hmm.
anxiety. Like if I get rid of the anxiety, then maybe I'll just be like lazy and not do anything at all.
Think swing completely on the other side of
Yeah.
things. Yeah. It's not super related, but I have a client right now who hears voices and the voices tell him when he's about to have an experience of mania and he doesn't
Mm.
want to get rid of the voices. I'm like, let's use the voice as coping then, shall we? Like
Mhm.
if you
Right.
start hearing that one voice, it's going to be mania time. So what do we do to
Mhm.
prevent that?
Mhm. It's
So
interesting.
unrelated to the topic of the day,
Yeah.
but I
Is
thought
that
about it
is
when I'm
that
thinking about
is
anxiety
that
as a
is
coping.
that is that bipolar disorder with psychotic features, or are they
This is
schizoaffective?
schizoaffective. Yeah.
Mhm. Yeah.
Yep. Which for those not in the industry, there's small differences between the two.
Small. But succinct. I tried to explain that difference because it took me a minute to
Hmm.
remember the difference, and now I haven't worked in I haven't seen a schizoaffective diagnosis in a while.
I saw
You
one
see
2
that a
days
lot. You
ago.
see that a lot more. You see that a lot more when
Yeah.
you're primary substance abuse.
Yeah.
Um, bipolar, with psychotic features, hallucinations, delusions, etc., are mood dependent. Correct.
Mm-hmm.
So like they may only come up with episodes of mania. And with schizoaffective, you have the mood changes, but the hallucinations, etc., are not mood dependent and could be there at any time. Right?
Exactly.
That's
Yep.
yeah, yeah.
That's it.
Just a little bit of difference there. But that's it. That's interesting that
Mm-hmm.
the delusion tells when mania is going to come.
Yeah. It's fascinating.
It
So
is
I'm like, all right,
fascinating.
he's not wanting medications. I'm like, all right, so we're not going to psychotropically treat. We're going to do some coping
Yeah.
and learn some safety planning. And that's what we're doing.
Yeah,
So
I mean, you have to do what they're willing and open to do. I've
absolutely.
been doing so much research on OCD lately because we have a
Mm.
new OCD program at my job, and we do like TMS for OCD.
Can you
And
explain TMS?
TMS. Oh God, I don't even remember what it stands for. But
Yeah.
TMS is it's an intervention for depression, and like it basically does something with magnets in your brain and your neural pathways and the neuroplasticity of your brain and all this stuff. And research shows that doing this, and most times you do it like 3 times a week for like 6 weeks. And it's gotten shorter. It's like 20 minutes, but it changes your brain and helps with decrease symptoms of depression. And so also there's research that shows that it works for OCD. So I do ERP therapy, which is exposure and response prevention. And I did an OCD training for the ERP. There's so many acronyms in our field. We just all talk in acronyms.
Which, by the way, TMS, for those
Hmm.
caring,
Yeah,
transcranial
yeah,
magnetic
magnet.
stimulation.
Yes.
There you go.
Thank you. Thank
TMS.
you.
Yep.
So anyway, so I did this whole training for OCD, and we talk about like all the OCD types that you can see. We talked about all the OCD subtypes. I don't remember us talking about like morality, OCD, scrupulosity, these kinds of things. And so I've been doing more research with that and seeing that some of my patients who present with anxiety and may look like it's generalized anxiety disorder actually have OCD.
Hmm.
So I don't remember why I started on this tangent.
I was talking about weird treatments for my schizoaffective.
Yeah, and so I think that like that's a thing. That's another thing that's happened with my patients I found who have morality OCD is that they have a fear if they stop the mental checking to see if they're a bad person.
Mm.
That if they stop doing the checking, then like they're just gonna like run amok. And
Yeah.
they would just go
Amok,
to
amok, amok.
all these wild desires that they have because they think that the checking is what's keeping them to act as if they were a good
Mm.
person, and how that's tied to trauma too. So if someone believes like I am a bad person, also it's fascinating to think
Yeah.
about like how brains work. And I'll be like, we have systems in your brain literally, like if you talk about Freud, like we have the id, ego, and superego.
Mm-hmm.
Like we have systems in place to keep you in check. Like you don't have to do all that thinking about it. Like you're not just going to wake up and doing some wild and crazy things. But that was like, oh, sure, okay, DJ. But fascinating. I love brains.
So, DJ, what do we do about it? You're the doctor.
Oh
How
yeah,
do we how do
burnout.
we how do we change the system? Not just ourselves, but what do
Mm-hmm.
we do? Because it's not just an individual problem. It's a systemic one.
You're right, and I think that like that's what I said. I think that when we're working just with like other counselors, therapists, a lot of times like we talk about this from the get. But I think it's when we're working with other career professionals, we have to keep asserting our boundaries. And we have to you have to know, like we talked about imposter syndrome and how that can keep you from practicing self-care. It's like being self-awareness, knowing where you struggle with that, and reaching out. And one of the things that we learned in grad school is that every therapist has a good therapist. And that's a
That's
thing,
true.
like if you're somebody and you know that you're struggling with burnout and you're struggling with being able to have those boundaries, being able to like reach out to a therapist, have a therapist, and also for supervision, reach out to a therapist who does have good work-life balance and ask, how are you able to do this? So
Mm-hmm.
I think and then having systems in place that that you have routines or something that allows you to integrate some self-care to try
Mm-hmm.
and prevent or treat burnout.
Absolutely. Yeah.
Mm-hmm.
I think, and it's slowly chipping away. First off, I think being honest and being upfront about experiences when you have the ability to do so. I recognize it's not safe for everyone to talk about their own burnout, but like
Mm-hmm.
having, just that ability to say, hey, like when I tell my team, my ego is going to show here for a bit. When I'm the director of this 200 plus member department or staff member department, and I say, hey, I'm feeling crispy. I'm trying to model for people of like,
Mm-hmm.
it's okay. Like, it's
Right.
okay to say, like, I need a beat. Um, you
Mm-hmm.
have to model that. And I had a
Mm-hmm.
conversation with a coworker recently who said, I used to get emails from your department at 2 o'clock in the morning. It was really normalized. And since you've been the director, I don't get those anymore. And I said, yeah,
Mm-hmm.
because I don't send them anymore.
Mm-hmm. Right.
um, I don't do that stuff. And I model for my staff of like, you know, take that time off. And that's how we change systems, even if you're not a director role, but to normalize taking time
Mm-hmm.
off and needing to unplug, I think slowly erodes this like
Yeah,
hustle culture that
exactly.
millennials glamorize because we have to, because how are you
Mm-hmm.
going to afford a house payment if you're not hustling,
Right.
unfortunately? And
Right.
that's a whole bigger system that is
Mm-hmm.
far exceeds the capacity of this podcast.
Right. And I think too that the same like and I know like Microsoft Outlook has if I go to send an email in the evening, it'll ask me if I want to send that email during work hours. So that's changes that are
Ooh.
that's some changes that are coming in place. And also that I think modeling that it's okay to make mistakes, modeling that it's
Mhm.
okay to take time off. And that's in my PTO policy at my job for my team is that it's your PTO. You're not asking
Mhm.
me when you can take PTO. You're telling me when you're taking your
Mhm.
PTO. As long as you communicate it and communicate that your patients need to be notified, that's all you need to do. And you don't have to give
Mhm.
any notice. If you want to take PTO that day, let us know in the morning. So I think that like normalizing that PTO is not something that that's like an extra special privilege that maybe you get to take some time. If you have PTO, you get to use your PTO.
Yeah.
Mhm.
Yep. That's what I tell people too. And like, don't take your PTO and then like work. And I know
Right.
that damn well saying I just said earlier in this episode, like, oh yeah, like I can take a call tomorrow if it's urgent, that's fine. But there's also a difference in my role
Hmm.
versus like,
Right.
I don't expect that from somebody who, is compensated at a different level or someone
Hmm.
who has a role that just has a different set of responsibilities than mine.
Right.
Yeah.
Yeah. Yeah. Good.
So let's change the system, DJ. Let's just
Let's
do
do
the damn
it.
thing.
We're doing it one podcast at a time.
One podcast at a time and
Hmm.
picking it up whenever we pick it up next.
Eventually.
Well, thank you everyone for your patience with us and putting out these episodes. It's definitely what DJ and I are doing to make sure that we're not burnt out. Because if we're just not in a capacity to make a podcast that week, we just don't.
Hmm.
So that's part of our modeling, is just deciding that sometimes elective things that we do for fun just don't get done because other fun life stuff is going to come up instead. But we
That's right.
appreciate all of you watching or listening and hanging out with us each week, each time there's an episode, sharing your thoughts. And it hugely helps us if you share the podcast. So share it on Facebook or Snapchat or YouTube, whatever. I don't know. What are people on these days? Twitch? I don't know.
Yeah.
I don't even know what that is. But
Hmm.
anywho, share, comment, like, subscribe, all of that good jazz, so we can keep on sharing the good word about some therapy. Well, we appreciate you all and thank you. We hope you have a great week/2 weeks/ whenever we see you next.